I'm Laura Bonnell, and this is the Living with Cystic Fibrosis podcast coming to you from Detroit. Please subscribe and even rate and comment on our podcasts when it moves you. I learn something new with every podcast, and I'm always inspired by the people that are showcased here. We don't give medical advice. You need to connect with your doctor for that. I hope that this Living with Cystic Fibrosis podcast educates you and sparks some volunteering or advocacy. The CF community needs people like you. Thanks to our sponsor, Beatrice, for their support. We're going to Brazil for this podcast. Brazil is famous for some soccer players, as you know, and it is the largest country in South America. It has 4 time zones. 60% of the Amazon rainforest is in Brazil, and their flag has 27 stars on it, and they speak Portuguese there. The food, oh my gosh, I've scrolled through pages of food, and it just looks so delicious. I've never been to Brazil, but Gabriel Johnson was born and raised there and now works there. He is the Projects and Institutional Relations Coordinator at Unidos pela Vida, Brazilian Institute of Cystic Fibrosis Care. He has worked for nonprofits for the last 8 years, and he graduated in journalism and marketing, so close to my heart. Gabriel has MBAs in digital marketing and project management, and he is currently a master's student in communication sciences at the University of Porto in Portugal. So yeah, he's traveling back and forth a little bit for school. Gabriel is a patient advocate for people with cystic fibrosis and rare disease in Brazil, and we are so grateful. He's been doing this for the past 2 years, and he is only 31 years old. So welcome, Gabriel. Thank you so much for doing this podcast with us. It's great to have you.
Thank you, Laura, for having me, and we're excited to get into all the things from the cystic fibrosis community.
You know, we did a pre-interview, we talked, and the fact that you will be 31 years old when this airs is impressive. So thanks again for all you're doing for the world in Brazil. You do come with a background in cancer. So what made you decide to get into cystic fibrosis?
Well, Laura, first of all, after 5.5 years working with breast cancer in a breast cancer patient advocacy group, I found myself in a scenario where, despite the known challenges that we have in oncology and cancer care in Brazil, technologies were they were advancing very quickly. There were plenty of options for therapies options to patients, and plays in the market, especially when we're talking about breast cancer. So it was a mutual friend who introduced me to Veronica, a cystic fibrosis patient. So she told me all the difficulties navigating the world of rare diseases and cystic fibrosis with little or no resources at all. That we oncology, wait a minute, we have a lot of drugs, pharma industries and everything. So you have almost none. And she was like, yeah, that's exactly right. So we have little or no resources, few companies to finance projects because it's a rare disease. Few people knows it, and almost nobody knows it. I didn't know it before. So we have few medications available for patients, few clinical studies. We have none in Brazil, none clinical studies in Brazil for cystic fibrosis. And people don't know about the disease. And there's no cure yet. And I was like, oh my God, it's a complete, this makes sense for me because in college, I was in my comfort zone. Everything was, of course, we have to treat our patients right in cancer. But from that moment on, I embraced the fight with her immediately and became a cystic fibrosis patient advocate as well. So it's been 2 years now. And I joined the fight with her together with our incredible team. There's me, Veronica, Camila, and Leah, and our directors, Cristiano and Marisi. We rock the world of cystic fibrosis in Brazil, and we're still doing history as we speak right now.
And it's wonderful. And you mentioned Veronica. So please tell us about Veronica Stasiak. She is the founder of, and if I mispronounce this, please tell me, Unidos, Pela, Vida.
Yeah.
So please tell us about Veronica and the organization that she started that you're working for.
Sure. Well, Unidos pela Vida, or United for Life, if you're going free translating to English, everyone United for Life, was born out of a dream, literally, of Veronica's. She's a psychologist. She was diagnosed late in life with cystic fibrosis, only 23 years old. During one of the many hospital stays to treat pneumonia and everything that comes with CF, she had a dream about the importance of the air we breathe. And then she created a project to bring people together with respiratory problems, because by that time she was an asthma patient, so a severe asthma patient. But when she was diagnosed, everything made sense, because she was like, no one else should suffer what I suffered. Everyone should know about cystic fibrosis, and I'm going to help everyone in the same situation as I am right now, to get to know cystic fibrosis and to better treat and everything. First of all, was to get to know, because she didn't know, but she had it in her since day one of her life. But then she was like, okay, I'm going to start a blog. And then the blog turned into social media community. I don't know if you Americans are familiar with, but Orkut was a very common social media back in the 2000s. She's 38 years old. She connected with a lot of families and people from this community, and the idea grew. So she brought together patients, families, associations. She navigated all the ecosystem of cystic fibrosis in Brazil, because she wanted to change stuff. She wanted to get to everyone to know cystic fibrosis, so no one has to suffer what she did. So in November 2011, the group was constituted effectively. So we became a patient advocacy group legally. So registered Instituto Unidos pela Vida, which means United for Life Institute. So we are headquartered in the city of Curitiba in South Brazil. So, and the rest is history. We grew to become one of the two main patient advocacy groups working nationally in Brazil. And it's safe to say, I'm here safe to say, the biggest one. Veronica organized the cystic fibrosis ecosystem in our huge country, bringing together 20 local associations that do more regional work, working closely with patients, assisting them and everything. So Unidos pela Vida do what these 20 local associations cannot, because they're working directly with the patients every day, day to day. So Unidos pela Vida see the whole thing nationally speaking. So everyone now is united everywhere to achieve the same goal.
And I'd like to, what we had talked about before was how she took on, or not, maybe took on is not the right word, but how she went to this group that was established.
Oh, yeah.
And said, well, you tell us what she said, because I don't want to misquote her, but she got things switched around. So very impressive.
Yes, she was very young. So there was 30 years old organizations already working with CF in Brazil. So everyone was like, what do you want here? You're the girl from internet. You're the girl from the blog. What do you want? Your place is not here. But then she gained trust with all the players nationally, even with the medical society. She's inside the medical society right now, but it was a really, she suffered a resistance from the status quo back in the day. Now everything works perfectly, but she had to unchain, I guess, this whole system to work together for a common ground, find a common ground for the same goal. So I guess that was it, or...
Yeah, that was exactly what I was thinking about. And we did invite Veronica and you to come on. And I know the reason she couldn't is her health. And if
Yeah.
you can touch on that a little bit about what she's going through, that kind of kept her from coming on this podcast. And of course, other things in her life.
Sure. She has a daughter, so he's always had the bug in the school. She's 5 years old, I guess. And sometimes she gets a little bit in about bad conditions. And so sometimes it's always ups and downs with CF patients. We all know that. So when I started working with her, because I wasn't back in oncology, I wasn't working directly with the patient, the leadership of the organization. She wasn't a patient, she was a doctor. And when I met Veronica, she was, in fact, a patient. And sometimes she was like in very bad conditions. And they were like, oh my God, what I'm going to do right now? But she always, of course, get off of it with a lot of exercises and everything. But sometimes she's down, but she's a very strong person. I used to say, and everyone else as well said, that she's a force of nature. So nothing ever gets her down, because she's fighting for over 6,000 patients in Brazil. But sometimes the disease reminds her of that she's a patient as well, and she has to take care of herself. And right now is one of those times. So she has to lay low a little bit, so to get better, to restart the fight. So
she has pneumonia because she got sick from her daughter, who is in the preschool with all those germs. That's what you're...
Yeah. One of the things, she doesn't want to, of course, escalate the problem. So, yeah.
Right. And I think that you so beautifully explain what you see in her and the struggles that she works through because she's sick. If you could describe what you see in her as this woman with cystic fibrosis, how she's healthy and sick, and how you learned about CF that way, that would be wonderful.
Sure. She's one of my professional inspirations. When I talked to her for the first time, I was like, oh my God, how are you even alive? Because all the things that you just told me, that happens to you. You have to remove part of your lung. You have a dozen, how to say in English? Let me check. Ribs, yes, of course. Lots of broken ribs in a very, you have a daughter that is completely a miracle.
Oh, maybe from coughing. Maybe that's what you're talking about?
Yeah, for coughing, yes. And she has a daughter. It was a very complex pregnancy, it's she risked everything, her health and everything. I was like, oh my God, I don't have problems in my life comparing to you, and she was very inspirational, and she took me, and I felt very respected, because it was a job interview. So I didn't know anything about cystic fibrosis. I worked with patients before. I worked with leaderships in patient advocacy groups before, but it was completely different. She took my hand and let's do what you did for breast cancer. Let's do it together with cystic fibrosis. I need you to be my the second lung that I don't have. So let's breathe together. And I was like, I'm all yours. We can do the work together, and it's on a daily basis. It's always like this, and she's very inspirational. And all of us actually were cystic fibrosis here today in Brazil have a lot of stuff and tribes because of Veronica. That's for sure.
Well, I'm glad that we talked about her and about what a force she is. And thanks for sharing that, because I thought it was really important to get a picture of who she is as it relates to the foundation that she started. And you beautifully described her and what you're all doing. So thank you for that. And Brazil does not have a cystic fibrosis foundation, so Brazil has no sanctioned CF clinics for your CF population of more than 6,000. So how does the hospital system work there? Tell us about health insurance and how medications are covered.
Sure. Well, in Brazil, it's completely different from the United States. That's the one thing I'm going to say, because it's very difficult to compare one health system to the other.
Mm-hmm.
So, but I'm trying to do my best here. Well, the healthcare system in Brazil is divided into basically the public one, where resides the Unified Health System, Sistema Único de Saúde, or just SUS, which is universal health coverage, is free for absolutely everyone, immigrant, born in Brazil, everything. You just go to the clinic, just go to the ER, you get what you need for completely free. You don't have any expenses shipped to your house later. And around 75% of Brazilian population of more than 210 million uses the public health system exclusively. So that's a lot, It
is. Yeah.
And of course, it's not the best conditions and infrastructures ever. We have a lot of flaws, but all our efforts right now are currently focused on improving the universal health system. So we directly impact the process of evaluating health technologies in different ways, so patients can have the best technologies available on the market, international market, in exams, procedures, high-cost medications, low-cost medications, free of charge for their treatment, because no one in Brazil can afford one of the CFTR modulators. That's for sure. No one. And sometimes not even the low-cost medications. Even for diabetes, or, I don't know, when you have problems in your heart, every medication, every drug is given by the government for free. So because chronic patients cannot survive paying everything by themselves. So no, we do not have a cystic fibrosis foundation in Brazil, like in the same terms, same lines as the USA. In Brazil, the nonprofits organizations like Unidos, Pela, Vida, and the other CF organizations that we have here hardly have funds to invest in clinical research, for example. And we know that CFF invests in research, in drugs, we can't do that. There's not enough money. There's too much. It costs too much. So our work here ends up being more assistant-based, directly with the patients. How can I say? And then after that, we do the advocacy stuff and fight for the public policies, fighting for the new drugs, and we do everything, but we cannot pay for clinical trials and everything.
And I think that's a really good point, because that's something we're dealing with in the United States, and we're going to talk about Canada as well, but in the United States, we have this science and innovation capability, but it's a whole another subject about the cost of drugs. And I think where people get confused is they just go after the cost of drugs in the rare disease community, instead of realizing that, yes, of course, we need prices to come down. Everybody would love that, but it's not at the cost of attacking pharma, because we need the money for these rare diseases. And the drugs are higher because you have fewer patients, and you want pharma to keep going with science and innovation to make more. So, every time I talk to somebody, it is interesting, right? Because each country has their challenge in the system. None of our systems are perfect. But the way you have it set up in Brazil, is it correct? So the patients can't get the medications because they can't afford them, or are they not accessible? Or is it both?
It is very expensive. You cannot go to the drugstore and buy Trikafta, for instance. Of course, it's going to cost like 5 years of salary. I don't know, even more. for a single box. I don't know. Most of patients cannot have it. And right now, we do not have access to Trikafta and Syndical and Orkambi because it's not available yet on our public system. So that's why one of the main things that we fight here with Unidos pela Vida, with our work. We pressure Vertex to, hey, go register your new drug on Brazil, because that's the first step. And then go, hey, would you please submit the process to get it evaluated so we can have a chance to get it in the system for everyone that needs. So, and then after that, we were like, hey, government, it's very important. So listen to me. That's something that then we have, we do a lot of things with doctors and patients. Please write some articles, publish stuff. And so we can have data to bring over when we are asked, because we have, there's a moment in the process that we are asked, the society, is that their opinion. So we do our homework and study, and not only, oh, no one's want to die, we need this. No, this is not enough. You have to prove that is, even though it's very expensive, it's better. It betters the capacity of life, the quality of life is improved and everything. So with data. So that's one of the things that we do here. It's exactly like this. We have reference hospitals for rare disease and cystic fibrosis in Brazil. So mostly teaching hospitals, that's where the reference centers are, normally in the main state capitals. And Veronica has a very good relationship with most of them. So she knocks on their door and I was like, so you treat patients, cystic fibrosis patients in the system, right? Or yeah, so let's do something together. You have to go to this website. You have to say that it's very important because blah, 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 all the scientific stuff. And you have to contribute. So people have, so patients have the chance of having this drug approved for the system free of charge. So that's why we're doing now with Trikafta, which is already approved.
Approved in Brazil, yes. That's great. And it's been a lot of work for you. And I do want to get back to access, but I just wanted to go through. So your Ministry of Health recognizes cystic fibrosis, and you have two health systems. One is the universal that 75% of the population works with. And then what is the second?
The second one we call supplementary health system.
Okay.
It's like the health insurance in the United States, but it's not exactly. There's a government agency as well that regulates a list of minimum coverage medications, procedures that these, we say, these health plans, health operators have to cover. There's a list of minimum stuff. A lot of them go beyond that, but mostly does not. So very costly and high, very expensive treatments like in cystic fibrosis, they're not there. So it has to go fighting justice and see what happens sometimes. So yes, but of course, when you have to go to a doctor, you just schedule an appointment. It's way faster that way because you can choose your doctor. So of course, supplementary health, everyone who has access and money, normally people who works on a daily, works professionally, have a job contract. Sometimes the employer gives as a benefit the health insurance, the health plan. So it's not accessible for, I don't have for example, I don't have full-time job, or I don't know, I'm a person who doesn't have a 8-hour day job, so I don't have access to it. If I go by myself, it's going to be so expensive. If I have precondition like a chronic disease, will be way expensive. So that's not affordable. That's not the system. is great for those who have access, but the Brazilian population mostly go to SUS for everything, since a vaccine through Tricafta.
And I wanted to get back to your access, with Tricafta. Take us on that journey, how you got there, because it was approved, you said.
Yes. Well, it was a very long journey because, like we said, as soon as Tricafta had the FDA approval, we began a campaign led by Veronica, and not her alone, of course. The whole 20 others, local associations and the other national one, everyone was together, brought together, was like, okay, so we have to have this here. We need to have this here available for everyone. So a lot of, I don't know exactly, my bad, when Tricafta received the FDA approval. But since then, Veronica and everyone else was knocking on the Vertex Brazil and said, so you need to bring here this medication. Oh, yeah, sometimes it's not possible. We have okay then. So we're going in global, Vertex Global now, okay? And then she went there, and a few days later, they introduced they submit for approval in Brazil. And of course, I'm simplifying a lot, but that's the kind of pressure that we are capable of doing, that we do here to get things done in Brazil. Otherwise, we'll be in the hands of the goodwill of the market or even the government. So after we did a whole social media campaign, so register the medication, please. We have to start the process of getting available. So so after that, it was approved, and it takes like a lot of time for getting approval for a new medicine here in Brazil. Even though rare diseases have preference, it's less time of waiting. But we did another campaign, so it's like, it's taking too long. What else do you need, government or the agency? And then after we did how do you say in English? I'm sorry again. Sometimes I forget words.
No, that's okay.
Like change.org, the campaign with everyone signing. We delivered for the government a list of hundreds and hundreds and thousands of signatures. So this is the number of people that needs and wants this medication registered, so people can... Like
the registry, is that what you're talking about? The CF registry?
No, register to become available for the first stage.
For everybody.
Yeah, for everybody.
Got it.
The first stage, it's like the FDA. You have to first go to the FDA, register.
Right.
And then the same goes to Brazil. After the FDA, you have to register in our agency. So after this register, you have to get approved. And get approved, you get a price. So after price, it's available for the market. So after that, people can go to justice. People can start to buy with their money if they can, and everything. So this is the first stage. So the agency was taking too long, and then we did a lot of signatures, thousands and thousands of signatures, and 72 hours later, it was registered. So
that's great. So you got it through your government.
Yes. Then after that, we received the prize, and then we started back to the pharma. So now you have to submit for the Health Technology Assessment Agency. It's another one. So then, yes, and after it's approved, it's available integrally for everyone who needs it. So there are a lot of stages that we have to learn in the first place.
Right.
And Veronica and all the people that works here had to learn. So she was like, I have to be the expert of it. I have to know when and where to knock and whose door, the person exactly who I have to email to, which congressman I have to knock on their chambers. So She became an expert. So she knew what she was doing. So that's how everything goes.
And I love that explanation because I think, and that's one of the things we have talked about before with other parents of kids who have CF and patients who have cystic fibrosis, is that who knew? You never thought you would be an expert at this. You never thought you'd be an expert at the disease, possibly know more than doctors, and be such an expert at either about your parliament or your government. It's just amazing how far we come because you have to know everything in your disease in order to make things happen. And it's really a beautiful thing when you talk with somebody about where they came from. They maybe couldn't even pronounce some of the medications or didn't know things. And now it's like, all right, listen, here's what we have to do and really take charge of it. So hats off to Veronica. Amazing.
Yeah. I did the same. When she was doing this for CF, I was doing this for breast cancer. And then we started work together. Then we improved everything. She did a lot of things by herself, like I told you. And they was like, no, come on, let's do it this way also. And then we put another ingredients in the mix, and we started to grow the work that we do together for cystic fibrosis patients. So it's that, and then education and health literacy and everything like this became a top priority. It was always a top priority here, but then it became even more because this knowledge of how things works, it shouldn't be limited to us and the work we do here. So we started to qualify and do capacity buildings, events and courses and everything to the other CF associations, explaining every step of the way, how it works, when it works, what you have to do in your state, what you have to do with your patients, how to introduce this subject to the patients. And then it comes naturally now. Everyone knows what to expect sometimes, what their role.
And is Trikafta now covered under your universal health care because your government does recognize cystic fibrosis and everything passed? So is that covered for 75% of your patients, that drug?
Yes, we got a green light September last year. So after a long process of evaluation, the technology in the Ministry of Health is one of their flags right now because they're using cystic fibrosis as an example of rare diseases and what they can do and stuff. This is a good thing for us. So as of February, right now, the Ministry of Health is currently in a final process of updating the guidelines. We say here PCDT, which is translated to Clinical Protocols and Therapeutic Guidelines. It's the doctor's manual of the public health system. If cystic fibrosis, treat like this and everything scientific. But now it's going to have Trikafta and other technologies that were incorporated to the public health system. Because if it's not there, the medication, the drug, of course, they cannot prescribe it because the patient cannot have access. But after updating it, it's going to be available. So if the patient has the availability and the indication and the mutations, they can prescribe and the hospital can give and everything. So it is approved and it is incorporated, but we have a lot of other bureaucracy to deal with, and we're getting all the steps. We're today as of February 8th, it starts the public consultation, because after these documents, these guidelines they are written by the government. They ask for the opinion of the society. So we have the chance right now, the doctors, the medical societies, the CF associations have the right and the opportunity to say, yes, this is appropriate. No, you missed this one. This thing doesn't add up. This is going to restrict the use. No way. So we can give the
feedback.
Yeah, complete feedback. So And then after that, they revised it and took the final decision about the guideline. So that's where we are today. But after that, we have to they have not us have to go to the logistics department. Everyone should get how much tricafta do you need in your state? So reference centers need to count and then give back. So it's a lot of bureaucracy. Sometimes they get lost, and we have to go there and say, so what's happening? How can we help? Let's do it together, and let me connect you with somebody else and everything, so it doesn't get lost in the bureaucracy. But yeah, we expect in the 2 months, 3 months is going to be on the patient's hands, because that's all they want. That's all they're talking about. And of course, because we had the green light, but it took forever to get in their hands.
So you think by May you might have it in patients' hands?
Maybe yes, maybe before that. So I'll let you know.
Absolutely.
Yeah.
Let us know. Because I remember seeing it on social media when you got approval. And it was, so exciting. I'm sure I had chills and tears in my eyes, because it's always so, you know what it means. You know what it means to patients. And would you say that it was a group negotiation that made it happen between all the parties? Is that how it worked? Having gone and continue to be going through this experience?
You mean the negotiation and the prices and everything?
Of the drug, working with everyone. I mean, was that the key for you? Was that
yes.
What made it work?
Of course, everyone united, everyone, because if you were here and the other CF association is there, and then the doctor who treats patients is another place, and no one chats, no one talks, no one gets updated, and everyone is doing their things, minding their business, it doesn't work. Things doesn't get done. So when you have one organization or more than one organization doing this whole process of getting everyone to know each other and knocks on everybody's door and really get things done and uniting everyone. Hey, you should know this guy, you should know that guy, you should know this member of parliament. He's going to help us with this and that. So when you do this, I don't know, let me check the translation here.
Sure.
The sewing of the of relations and everything gets done perfectly, and united, everyone gets to fight together for the patients. So everyone needs to know their role in the process. But if no one organizes it, we can do it, because that's how it works here in Unidos pela Vida. If no one is doing, Verica told me once, if no one is doing it, we're going to do it.
Absolutely, right? That's how it all works.
Yeah.
Is people who either have the disease or have someone with the disease, it's up to us, because no one else is going to do it for us. So
exactly.
Very well said. I just wanted to move on to newborn screening, because it was interesting to learn that you started testing for cystic fibrosis before the United States did. You started testing in 2001, and we didn't start testing here for cystic fibrosis in newborn screening until 2007. So do you feel like there is a handle on how many CF patients? You have more than 6,000 CF patients, but do you think there's more that just are not getting diagnosed, or because of newborn screening, do you feel like you're diagnosing people pretty well? Because you have a huge population.
Yes,
in Brazil.
Yes, there's a combination of the factors, I guess. Of course, we have since 2001, government introduced the national neonatal screening program that really shaped things from then to now. And cystic fibrosis, one of the six, I'm guessing it was 6, if I'm not wrong, diseases, screened. Mm-hmm. So since it was a national, a federal law, so everyone every 27 states has to adopt it. Of course, it's not perfect, but yes, it helped a lot for the number of diagnosis, because it's not the only thing you have to do to diagnose. We have the sweat test that we, of course,
Right.
have a lot of problems here in Brazil. Not every place has the machine and everything, so we have some lacks in the coverage as well. It's not perfect, but I'm guess yes, it's one of the things that was contribute to the fact that we had more diagnosed. But we know we probably have more than 6,000 patients, some in places that we don't have all the procedures correct, where doctors don't know cystic fibrosis yet, so they don't test it or don't. Sometimes the food test, we say here, the food test, sometimes it gets a false positive or negative and stuff. Sometimes it fails. But yes, I guess one of the things that, and this and the registry of the patients, that now it's the registration of patients, which is mandatory.
I think, too, one thing that you mentioned is really important. It isn't all about one drug. It isn't just about Trikafta. It's about the fact that you might not have a sweat test to diagnose. There are basic things.
Yes.
Right? It's about so much more. It's, never just about one thing.
Exactly. After the newborn screening, there's a lot of other things, procedures that you have to do, written in these guidelines. After 2 food tests, you have to go to the sweat test, which is very complicated. Like I said, there's not enough places. You always have to travel a lot to do it, because sometimes we live in the state of, I don't know, you said something about the Amazon River. So you live somewhere there and you have to go to the state capital, and it's very complex. Sometimes people don't go, and we have some other issues, and it's not every place is. Sometimes even our database is not updated, because we have more than 700 people asking Unidos every year, where can I get the sweat test? Every year we update the information of where, because some places 1 year apply the test, the other year they don't do anymore. We don't have the demand enough, or it's broken, or I don't know. A lot of things happen, but everyone needs the sweat test. And normally they came to us asking this question, but they're completely desperate of maybe there is cystic fibrosis, and their whole world will be expanded now, and they gotta know everything, and that's how we enter as well.
And I think that's something that I am constantly trying to point out so that people listening understand. This is not about just one drug. You may get Trikafta, but it may not work because you don't have the right mutation.
Yeah.
It only works for 90% of the population. You may get it, but you have a nutrition issue in the country. I'm not saying Brazil does, but like India, for example, does. So there's basic things that need to happen also. And then it's about the next drug. We want the government, the parliament, we want it to be ready for and accepting and willing to work on the next drug. So that's why I always caution people about just pointing a finger at one thing, because we really have to get it so that everything is accessible, and to prepare the parliament or the government for the next drug that's coming. I mean, for DMT, they're in clinical trials with an aerosol drug that could help 100% of the CF population. I think it's in the half phase right now. And that is huge. So we need to get our government's heads wrapped around the fact that, people with CF and in the rare disease community, they need access to all the drugs. So yes, it's important just not to focus on one thing, which, I know you're experiencing as well.
Yes, and there's a lot of other things that's smaller, that maybe cost less. We have the interdisciplinary team and everything. With the diagnosis complete, you have to be able to have access to everything that is available. So it's not only the Trikafta or the next drug or there's a lot of things going on at the same time. There's a lot of clinical trials, experimenting a lot of different things. So yes, it's not only about one thing, but sometimes it's hard to our community. You say, we don't have Trikafta yet, but you can use Cynical, Listen, there's a lot of different medications that maybe you have, so it's also hard for us.
It is hard. And I do get that. I do get that fear and desperate feeling as a parent. I do get that. You think this is the only thing, or, so I do understand that fear and concern. But yeah, we need it to be equal in every country around the world. Everybody should have access to a sweat test, basic. So we need to remember, we need to focus on the basics. Everybody should have access to enzymes. They do not. Everybody should have access to ADEX vitamins, the ADEK.
Yeah.
And everyone doesn't. And everyone doesn't have accessibility to liquid vitamins. So we have a lot of work to do, but I am so glad that you're in it with us. And I wanted to ask you about Brazil's rare disease strategy. Do you have one? And if so, tell us about that.
Well, in the following years and the past years, there was a lot of different progress in that area. There's a bill on Congress right now, the statute of the rare disease patient. So kind of introduces and gives the start of the rare disease strategy nationwide. So we have rare diseases and ultra rare diseases. Our Minister of Health acknowledge every one of them, but sometimes they don't have the guidelines yet. Some rare diseases doesn't have the guidelines. Cystic fibrosis is one of the few they have. We are very privileged in cystic fibrosis here in Brazil as a rare disease. We have ecosystems. We have a different. We have registry. We have guidelines and everything. So other rare diseases is still fighting for a guideline, still fighting for the basic rights, And there's everyone is start to a mobilization towards that. In Congress, we have the Rare Disease Committee. So now we have a place to discuss, so parliamentarians can discuss the rare diseases. Sometimes we get asked to go to the Congress, the Senate, to discuss and everything. We are to these hearings, public hearings that they host. So there's a movement towards rare disease strategy here in Brazil. And I guess we're in the beginning of that, but we're being part of it. One of the things that Unidos pela Vida and other players want to get it done is to equalize the rights of patients with disabilities and patients with rare diseases, for instance, because people with rare diseases should have the same benefits that disabled people in Brazil have, because they have a lot of different rights, social benefits and everything that a chronic patient with rare disease, chronic patient does not have, because sometimes you can't see that the people have cystic fibrosis. It's not, it's not in plain sight. So
right. We call it the invisible disease.
Yes.
Because you look fine.
Yes, you look fine, so you should be fine. No, of course not. I sometimes, Veronica was once, we're walking, trying to get a restaurant for, and then she was like 50 meters. She was like, and oh my God, I didn't understand how it really worked, because she was fine. She was talking to me and she was like, and then she couldn't breathe anymore. And I was like, oh my God, I sometimes forget that we're even a patient because it's not right there.
Right.
So we're trying to also, in the Congress and everything, to get the same rights as people with other disabilities and everything. So because sometimes parents have to stop working, patients cannot go to, speaking rare diseases in general, they have to get benefits from the government. There's a lot of social stuff involved that we want to get it done. So we have a lot of fights to fight, a lot of fights to fight in the following years.
Absolutely. And I'm so glad that my friend, Beth Vanstone, who's the mother of 2 daughters, one of whom has cystic fibrosis, I'm glad she connected us. As far as I'm concerned, she's one of the best fighters and advocates for CF in Canada. So I'm always grateful to her. And I had a couple more questions before we wrap up here, but if you could say it in Portuguese and in English, because I want to hear your beautiful language. But what are your hopes for people with CF in Brazil?
Let's start in, what language do you want?
Start in English and then...
So you know what you're going to say. Yeah.
Yeah.
Okay. I really want to cystic fibrosis patients have everything they need, have everything they live with quality of life. That's what I really work every day hard with Veronica. I'm actually just her partner in this fight. She's of course the main character in everything. But all I want is everything to have the best treatment they can, the best treatment that there is out there, and that's how what I want. And also, I want to make a pledge to all the pharma industry around there to fight for a cure, try to discover it, because there's a lot of people everywhere that needs it. So yeah, all I want is to people live with quality, find the cure, and have the best that they can while the cure is not there yet. Now in Portuguese.
Yes, please. Thank you.
Eu quero que as pessoas tenham o que há de melhor, né? Qualidade de vida, e que as pessoas, e que a indústria farmacêutica encontre uma cura para fibrose cística, para que todo mundo tenha o que há de melhor. É isso. That's it.
That is wonderful. Thank you. It is so beautiful. I love the way that your language sounds. So thanks for doing that. I appreciate it. And one last question. What are you most inspired with while you're working within this cystic fibrosis community?
There's actually a very easy question to answer, because the unity of cystic fibrosis community is completely different than what I was working in oncology. Of course, there's oncology. It's like a lot more patients, but sometimes they get cancer and they got cured most of the time with technologies that we have now, and they just live on with their lives. But nothing compares with the look of a cystic fibrosis parent, a mom or a dad, the thing in their eyes that will never give up for their trying to do the best for their children. This is inspiring. I never see anywhere else. So everyone is united for this for this particular thing. It's not how can I say this? It's a very resilient community, and we're so tight. We're so together with everyone else. No one gives up anything. So I guess when we need the community, they're always there for you. You don't have to do anything else. That's something that is rare to see somewhere else. I didn't see it anywhere else. So nothing compares the look of the parents' eye with a person with cystic fibrosis, and then they were like, I need to get things done. My children have to live forever if they can, and I'm going to do the impossible. The impossible. It's up to me now. So no one else is fighting this fight for me. It's up to me now. So that's one of the most inspiring things that I see here every day, and inspire me to continue the work that I do here with Veronica and Leah and Camila and Cristiano and Marisa and everyone else.
And I think that's so beautifully said. and that I find is true around the world. Whoever I talk to, the dad in Jordan, the mom in India, the parent in Egypt, Thailand, in Ireland, in England, it's the same. We're all in this together, the same feeling of no competition. We're just after the same thing. We want the same thing for everyone.
It puts everything in perspective, you know, when you look at this and you look at this fight, you know, and Veronica always told me, I want to be a grandmother. So that's why I'm doing this. I want to see Helena's grow up. I want to see everything. I want to be there every step of the way. And that's why I'm doing it. But I'm not doing just for me. If I'm going to do this, I'm going to do for every one of 6,000 plus patients in Brazil, because everyone should be grandmothers and grandfathers and everything. So yeah, that's just the most inspiring thing that I can say about this. That's why I love the job that I do here and what drives me every morning.
Well, thank you for being in it with us and for sharing this story and Veronica's story and your story. We really appreciate and are glad you're in this CF community. So thank you very much for working with us.
No, thank you. Thanks for having me. I'm sorry Veronica couldn't be here, but if she was a little better, then she, of course, would be here with me. But yeah, thanks for having me. These initiatives like yours and Beth's and everything, it's very important to the cystic fibrosis community. So we should always do things together like this, exchange ideas and thoughts and how it's there, how it's here, what can I do here, what can I do there. So yeah, count with us, count with me, Veronica, Unidos pela Vida, and everything. Yeah, thanks for having me, and see you soon. See you later, I guess.
Yes. And you did Veronica proud. And we're putting the contact information for your foundation. It's in show notes, so people can find it and check it out.
Perfect.
Thank you.
Thank you.
The original music in this podcast is performed by Kevin Allen.
It's not complicated.
Who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org.
This podcast was produced by Jag and Detroit Podcasts. Follow our show on Apple, Spotify, YouTube, or wherever you're listening right now.